Every year, millions of newborns face the risk of brain injury due to birth complications, leading to lifelong disabilities or even death. Protecting Brains and Saving Futures, or PBSF, aims to revolutionize neonatal care with a combination of neuromonitoring, AI, and advanced medical training. Gabriel, what is the scope of the problem we're facing worldwide vis-a-vis infants that are at the risk of having disabilities?
You know, Anthony, every single year we have over 10 million infants at high risk for brain injury. Many of these diseases are lack of oxygen during birth, prematurity, babies with congenital heart disease. And among the absolutely devastating social impact among families when they have a baby with severe disability, and we're talking about cerebral palsy, blindness, deafness, learning difficulties, but also there is the economic burden that is devastating. If we talk only about direct costs, for instance, lifetime costs for each child with disability in mean could go over $4 million US, but we also have the indirect costs such as loss of productivity, which is definitely a huge issue worldwide.
Protecting Brains and Saving Futures is the platform company that you're building. There are a lot of components to the technology that you've included around neonatal care to help increase the likelihood of a successful outcome for an infant at risk. Can you outline the components of the solution?
So to help these millions of children, we developed what we call a software plus healthcare as a service solution, in which we are combining multimodal monitoring with artificial intelligence and even immersive technologies to improve quality of care. So basically, what we're doing is streaming and integrating all data from different monitors of thousands of babies, and we're using AI to empower remote experts 24/7 to provide more precise diagnosis and assertive treatments. Our solution, for instance, was able to detect life-threatening events up to 8 hours in advance, allowing timely interventions.
What are the opportunities to use the technology in other markets beyond neonatal care?
Preventing neurological disabilities is not something only important in the neonatal care, right? So actually the way we have built our solution, that is integrating all the data from different monitors, combining with AI and empowering experts, it can be useful in the pediatric ICU, in the adult ICU, actually anywhere in the market. Então, we truly believe that this kind of system is truly powerful and will break the barriers of neonatology very, very soon.
Gabriel, have you been able to measure success and outcomes to date?
Building this digital health system is not only about monitoring, it's about improving outcomes, right? So we have published results in over 20 scientific international journals. For instance, in Brazil, after and associated with implementing this digital health solution, entire regions faced the lowest infant mortality rate ever registered in our country. And basically what they saw is that they reduced it by 50% the mortality rates of the premature babies, and decreased the 50% the rates of brain injury, and also decreasing length of stay. So take a look that associated with the implementation of this digital health strategy, this hospital, for instance, reduced mortality, morbidity, and also cost. And this is truly, truly powerful.
When you identify a new collaboration opportunity with a hospital or healthcare system, what are the steps you take to get the solution deployed, given there's just so much infrastructure already in place, so much training already in place with the existing clinicians and practitioners?
A key point is adapting to the different environments, right? We have these projects, for instance, in the US, but we also have projects and we are implementing our system in centers near the Amazon, back there in Brazil. So basically, we do a survey in which we understand the environment itself, if the neonatal ICU requires any additional equipment, and we lend that to the hospital, but then we
lend it to the hospital?
Exactly.
So you're incurring the capital cost, setting up the system, and then shipping it to the location?
Exactly. Exactly. And then after that, we do all the initial training and longitudinal training and education itself from experts that can work 24/7. And the beauty here is that we can integrate our solution to existing medical devices. And with that, we can scale globally and even bringing this solution in our path forward, not only to the neonatal ICU, but other environments as well.